Everyone that's joined so far, thank you so much for joining. It is great to have everybody with us on day 3 of the Sikh Coalition Summer Series program running this whole week. And this evening, our conversation is titled Understanding Domestic Violence in Our Communities. Again, thank you so much for joining, and we'll jump right into our conversation for the evening. So tonight with us, we've got Mallika Kaur, who is the co-founder and board chair with the Sikh Family Center. Mallika is a lawyer and author, and she focuses on international human rights with attention to gender and minority issues. Mallika has worked with victim survivors of gendered violence since the early 2000s. And as she's worked as an attorney, she's worked as an emergency room crisis counselor, and also as an expert witness on domestic violence cases. She is the co-founder and board chair of the community-based nonprofit organization, the Sikh Family Center, and they are focused on promoting healthy and violence-free families across the US. Mallika, thank you so much for joining us tonight. Next, we've got with us Navneet Bhalla, who is the executive director at Manavi. Navneet currently serves as their executive director, and Manavi is a New Jersey-based South Asian nonprofit organization that is dedicated to ending all forms of violence against South Asian survivors. It was founded in 1985, and it was the very first organization in our country to address the unmet needs of South Asian women affected by violence. Thank you so much, Navneet, for taking the time for this conversation tonight. And lastly, we have with us Pooja Raj with Sakhi for South Asian Women. Pooja was born and raised in Jalandhar in Punjab, and she moved to the States to New York City when she was 8 years old. And over the years, she has held onto her roots while immersing in the culture of New York City. Although she went to university to pursue business management, she discovered her love for clinical social work and pursued a whole other path, embarked on a new journey. And since graduating with her master's degree from Columbia University, she has worked to become a catalyst of change within her community and stand with survivors of gender-based violence. She continues to dream of pursuing a PhD to narrate the untold stories of many South Asian immigrants and their children, including her own family. Thank you so much, Pooja, for doing the work you're doing and for joining us tonight. Again, thank you all three for joining us. I am excited to have this conversation with y'all, excited to learn and have some action steps that we can take as a community. My role tonight is as the moderator, and just for some background information, my name is Aasees Kaur, and I work with the Sikh Coalition's legal team. And with that, everyone that has joined us, please feel free to use the chat function, the Q&A function, to send in any questions that you may have about the conversation we're having. We understand that the conversation we're having tonight is a difficult one. So, we will be incredibly mindful of the topics we're discussing and the care and love that goes into addressing these problems. So please send in your questions and we may answer them as we go along in our discussion, or we can also answer them at the very end. With that being said, let's jump right into it. And first and foremost, for everyone that's joined us, I think it'll be helpful for us to define what domestic violence is.
Sure. I can define if you like. So domestic violence is basically it's an epidemic where someone in an intimate partner relationship uses a pattern of behavior over time to exercise power and control over their partner. And generally it may not be visible right away. Things like, physical and sexual abuse may not always be visible right away, but over time, as they gain more power and control, it escalates. And it comes in various forms, which I believe we'll be discussing later on.
Awesome, thank you. Well, you've led us right into our second question. What are the different types of domestic violence? We'll start with that, and then I'll add some follow-up questions to that.
Sure, I can take that. So, or begin listing the different forms. So as Navneet said, there's the physical and the sexual violence. Then there is the non-physical, emotional, psychological violence. Other things that people often don't think of, like spiritual violence, actually preventing someone or forcing someone to, tu bahut zyada paath kardi hai, tu enough nahi kardi, tu apne balwatte munne, tu nahi, these kinds of like, you're doing too much, you're doing too little, controlling people in that way. There's financial violence that we see a lot of, financial control, and that especially in, right now we're sitting in this huge economic crisis in this country. So it's really relevant to think about financial abuse and how that prevents a lot of people from leaving domestic violence situations. There's verbal abuse, oftentimes that old trite saying of words hurt more can be very true for domestic violence survivors when they've just been dealt with a lot of verbal abuse for that's unprovoked and entirely used to shatter their sense of self or confidence. I don't know if there are others that folks want to mention.
I think you've listed all of them, Mallika, but there's also immigration violence that, is very prevalent within our community, right? This can be an individual marrying someone back home and bringing them over and using their immigration status and pressuring them into certain types of behaviors or certain roles and certain commands. And that very much exists within the community I serve, and I know you serve as well, right? Because 95% of the survivors I work with are immigrants.
Mm-hmm. Yeah, and that actually, I don't know how as an attorney I forgot this one, but litigation abuse is something we see a lot of. I'm sure everybody on here is very familiar with, but those who are listening who are not familiar with, it's really continuing the court system as yet another fora for abuse and control, and really knowing that it's the last place a victim survivor wants to be, talking about their private life and explaining all of their decisions, but keeping them in that system and making them return repeatedly for reasons that are just to forward the abuse and have nothing to do with rights or the law.
Yeah, and I think isolation is, at the best of times, our survivors they feel isolated, but now during COVID-19 and during a global pandemic, it's particularly a much more significant barrier and a form of abuse where, if you can just imagine being quarantined with your abuser. So your home is a safe place for most of us, but for survivors, this is a particularly difficult time, and isolation is another form of abuse.
Wow.
I'm sorry, Aasees.
No, go ahead, Pooja.
Thank you. I think one important thing to note is something that Mallika was touching on earlier as well, is that abuse does not necessarily stop when a survivor leaves the abusive relationship, right? Because if abuse is about like exerting power and control over another, children can be used, especially if like there are children from the relationship, right? So the court system, like Mallika was mentioning, is used to continue to exert power and control. Things like visitation, child custody, child support. So it's important to like note that as well, because I think a lot of folks, believe that like it will stop when the person leaves the relationship. That's not necessarily always the truth.
That's a very good point. Thank you so much for adding that on to our unfortunately long list of different kinds of abuses and violence that exist. And Mallika, you already mentioned a couple examples, but what are some of the glaring signs or even the not so glaring signs of these different types of domestic violence and abuses, right? So how can we try to start picking up on the signs. So how can we try to identify the different types of violence if a survivor is, not able to communicate that to us?
Yeah, our media around domestic violence, increasingly, I guess there are television shows that are doing a better job, but in the large part has made us think of a certain kind of survivor and a certain kind of response, right? The sunglasses, the long sleeves, hiding the bruises. There's all of that, of course. There's those visible signs. But 90% of domestic violence relationships, according to experts, are non-injury based, right? And there's this model called, and this way of thinking called coercive control that I particularly like talking to people about and community members about, that it's really not, and this ties in with the isolation that Navneet was mentioning before. Like, it's not the things, even it comes to a point where it's not the things that a survivor or victim is stopped from doing, it's the things that they themselves do not do, because they're constantly walking on eggshells. They know how not to, how to keep that pressure cooker at bay and for things not to erupt. So the signs, they range. It depends. I recently talked to somebody who was mentioning how, when her husband started losing it, even in public settings, like losing his temper, and she knew things were going to get bad by the time they got home, somehow what she had done as a method of deflecting attention so that other people didn't notice that he was abusive and angry, is like she would make a joke out of it and make banter, right? And people started around them, even their very close friends who suspected and honestly probably knew but just didn't want to deal with it, would say, oh, you both are so funny, like you both are so, that. It's like normalizing the abuse. Those are the things we have to really prevent ourselves from doing. If we feel uncomfortable watching two people interact, I think it's okay to sit with that discomfort, and then ask some questions later, instead of just kind of doing the whole parda pa dena or to cover it up. And other signs, are things like, because there's isolation being enforced on people, some of the examples are folks canceling things, plans that they're really excited about, and last minute they're canceling on them. And again, we have this idea of the victim or survivor of domestic violence as the person at home, we all work with folks ranging from the neurosurgeon to the teacher to the domestic violence lawyer, right? We deal with people of all backgrounds who are trying to cover up for what is happening at home, because they're just trying to live through it and survive through it, not because they think it's right. It's just something that they're right now having to survive. So I think looking for those signs of somebody obviously trying to hide things, and this is where it becomes complicated, because you want to ask questions in the most open way possible so that it doesn't seem like you're prying into their personal lives, but opening the door a little bit so that they may have that opportunity to tell you a little bit of what's going on if they want to.
Yeah, that's true. Are there any signs of financial abuse or some of the other kinds of abuses that were mentioned?
Yeah, so I actually wanted to just take it one step further, something that Mallika touched on, in terms of if you see signs of abuse, and then we can come back to the financial abuse piece too. Just something important to consider for all our listeners. If you do see, or if you suspect or think someone may be, a victim of abuse, it's really important to take what we refer to as a survivor-centered approach. We've had situations where many times someone with all the best intentions, and they see someone who may be abused and they try to intervene, but sometimes that can end up making the situation worse. So like Mallika said, creating a slight opening and having a slight communication, but being mindful and being aware that ultimately the survivor is the one who knows their situation best. So for example, we've had situations where it's not always safe to call or text the survivor or email the survivor. So if you're listening and you think someone may be abused, you just maybe need to think carefully. Is it safe to contact them? Is it safe to check on them via email? Because very often the perpetrator or the abuser is really screening their calls, it's checking their emails, and we've had situations where that person sometimes ends up cutting ties with their neighbors and friends who are checking in on them. So doing it in a way where you're just mindful that it's safe, and very often even doing some research for that survivor, because they may not be able to do so, looking at resources and just subtly, making sure that they are aware of what help is out there and what resources are out there. So when they feel it's safe for them to reach out, they're able to do so. And yes, in terms of financial abuse, absolutely, we see that all the time. Many of the survivors that we serve are immigrant survivors, and children are in play, and we see situations where financially, a significant number of survivors are financially dependent on their spouses. So having, withholding food, withholding any kind of, we've had situations where their internet access is cut off, where they're not given any money to buy any supplies for schools or children. So we do see various forms of financial abuse in the cases that we deal with.
If I may add, some of the other things to consider are like, is the person's paycheck being withheld, right? Are there multiple credit cards on the survivor's name that are being used by the individual who's perpetrating the violence, right? Is the person given a very tight budget to do things, right? So I've worked with survivors that were told that they were given like $50 a week and told to run the household, right? And all of us that live in a Punjabi household know that we cannot run our household on $50 a week, right? There's so many groceries to purchase. And then there was like a close examination of all the on all the purchases, right? So it's those little things that we think are just like, oh, maybe he's just very he just is very controlling of the finances, right? And it's just because he works hard. It's actually, there are signs that he has controlling behavior in nature, or she has a controlling behavior in nature. And we have to be mindful, right? As well-wishers of the individual that's on the receiving end of it.
And words matter here, right? Like when people talk about my house, right? It's when everything is my, right? You might, and this is where culturally we have to start intervening in families that have obviously situations of violence, and in all our families, that even if you are right now in a safe situation, I think it's really important to examine language and what we're passing on and what we're making normal. So if it's this is my house, this is my car, don't touch my stuff, if everything is mine. And we see this in general, where people will, how they even refer to, who works hard, like I'm the one who's tired, I'm the one who, so those things just go to show that somebody's off that mentality of, no matter if they have a homemaker who's taking care of running everything in their life smoothly, taking care of their health, taking care of their kids, taking care of their parents often, if they're referring to it always as, well, she's just sitting at home, those are obviously signs. And I think what Navneet shared is so important, of just knowing how to actually bring up the conversation is a skill in itself. You don't need to go necessarily through a training, but what you could do is pick up the phone and call any one of our organizations for suggestions before you go in full force. And that's actually a lot of calls in this time during COVID that the Sikh Family Center has been getting, of people are saying, I'm not quite sure, like I used to see this woman at Gurdwara, I was able to check in with her. I used to see this woman in playgroup, I used to be able to check in with her. Now I can't. What do you suggest I do? And we're all happy to have those conversations, because the detriment of a well-intentioned but ill thought out intervention, right, can be really, really bad. So, or can be really high. So we don't want anybody to have to bear that cost. This doesn't mean don't help, and this doesn't mean don't look out for the signs. It just means think about it a little bit more, talk to others if you're unsure.
One other point on financial abuse I just wanted to touch on is that, I said earlier that many survivors are dependent on their spouses, but we also see the flip side. So I just want to make sure that I clarify that it's not as simple as just where they're dependent. We've had situations where the survivor is the one who's actually earning the paycheck. And we've had situations where the perpetrator has been a dependent on the survivor, and despite the survivor being a successful, basically successful career woman, they've had to give their check to their perpetrator, to the abuser, because just going back to power and control, over time, the perpetrator, the abuser, has exercised such power and control that despite the survivor being the one who brings home the paycheck and runs the house financially, they are totally controlled and hand over the check. I had a survivor who said she had no idea where the money was going. She wasn't allowed to touch it. She would just come home and hand it to her father-in-law. And to also mention that we also see abuse in extended families, particularly in our culture, in our community, which doesn't get talked about often enough. It's not just between husband and wife, it's intimate partner relationship. It extends various forms of intimate, domestic relationships, and relationship with abuse is obviously another one.
Thank you. And if at any moment y'all have anything more to add, the conversation has taken a turn, please, go with the flow. This is an important conversation, but also the fact that all of this is happening organically, it's really great. And we're already getting a lot of questions coming in. So, we've got a full house and everyone that has tuned in is engaging. I know we mentioned a little bit about COVID-19. So I wanted us to touch on that a little bit. We're, 5 months into this pandemic. We heard Mallika talk a little bit about how the work of the Sikh Family Center had shifted. So, I want to put the question out for everybody. How has COVID-19 impacted domestic violence? Are your organizations seeing an uptick? And how have you shifted your work given physical distancing and other issues related to being isolated at homes?
Yeah, I think there's multiple articles out there that speak to the increase in gender-based violence recently and domestic violence recently, considering that folks are locked up in their homes. And we were mentioning earlier that often homes are not the safe places for a lot of survivors, right? With that being said, because homes are not, safe spaces, all of their movement is also being monitored, right? So for us as service providers, it's very difficult to engage with the survivors that we were engaging with before and prior to COVID. So we have had to take very creative approaches to our responses. For example, I'm a mental health counselor at Sakhi, so I focus on mental health. And I have sessions with a client on a weekly basis, but she resides with her perpetrator. Before, she was able to come into the office to see me for services. And now she tells him that she's speaking to like a college counselor, right? That's talking about education. So whenever he's around, there's a safe word that we have developed, right? Mm-hmm. So she just says, she goes, my papers, right? And that's when I know I need to hang up. And she needs to know that she needs to delete our chat, if there is a chat, every day, right? So there are certain safety planning that you do around this. And at the same time, being organizations that serve the community, we have to focus on the community needs, right? So all of a sudden, the community need became like access to basic needs, right? For us, we developed something called a food justice program that was delivering groceries to a lot of the vulnerable survivors that we worked with, right? A lot of folks lost their jobs and lost access to like HRA benefits, right? So Sakhi developed a response to that. We also had an increase in folks who wanted greater access to mental health services. So my caseload doubled all of a sudden, right? Which is great because nobody ever wants to talk about mental health services otherwise. So I was great, I was really happy to see that. But like Navneet was saying, one of the ways in which like folks, target survivors is through isolation. A lot of the isolation that folks are experiencing during COVID is mimicking the isolation that they might have experienced in their abusive relationships. So there's also a lot of triggering, right? So there's been an increase in mental health services, there's been an increase in needs, and there has been an increase in how we respond to those needs and the creative ways in which we respond to those needs.
Thank you. Navneet or Mallika, y'all want to talk about how your organizations shifted priorities or work during this pandemic?
Navneet, go ahead.
Sure. I feel like I'm freezing, but yeah. So basically with us, Manavi has taken, can you hear me?
Yes.
Yeah. So all our services have been moved to, basically we're doing everything remotely. So we have a transitional home called Ashiana, which was established in 1997 and is the only culturally specific South Asian transitional home of its kind on the East Coast. So it's a very valuable service for us. So what we have done is we have been providing support groups remotely for survivors. So that's how we're able to connect with them and provide that service. We have a 24-hour hotline that we've always had historically. So for anyone listening, our hotline number is 732-435-1414. We have a dedicated team of volunteers who are trained and staff or advocates. And the 24-hour hotline has definitely been one way for us to ensure that we connect with survivors. With the transitional home, we have also been providing groceries, food, supplies, all their needs have been met. And it's a rent-free facility where we house survivors and children. And they can stay for as long as up to 1.5 years or longer. And our goal really is to ensure that we provide all services. It's a rent-free facility to ensure that survivors are supported in a much more holistic manner. And also, I think we have also seen, and I particularly have noticed that during COVID, we've had survivors reach out to us in ways that they haven't always reached out in the past. So, for example, Instagram message or an email at like Sunday really early or Saturday. So usually it would be Monday to Friday where you would see the calls or the emails. Now I think, whether it's through social media or contacting through alternative means, but also at very unconventional times where I have now learned to really keep an eye on that, messaging. And I think the biggest piece here is for us as advocates, as agencies, to establish a safe mode of communication and some kind of code language if need be with the survivors, because during quarantine, we need to be particularly careful and mindful of their safety because the abuser is there the whole time.
Yeah, I think for Sikh Family Center, it's called a Sikh Family Center. When people ask where is the center, it's entirely virtual, right? We're a very, compared to the two organizations represented, the other two organizations represented here, it's a very small and new organization and entirely volunteer run. So we depend on these larger organizations to, we provide referrals to places such as Sakhi and Manavi when it's a person from the East Coast or people here. There have been an increase perhaps in questions around mental health referrals for sure. So everything that Pooja is talking about are things people can do when they're in the house. And they're people whose, quite frankly, whose abusers don't really care. Like, oh, she's talking to some therapist, whatever, right? There's those people too. There's a range. There's no one type of situation. So we definitely know of people who are like, yeah, I'm able to get, remote counseling therapy sessions. I can do those, no problem. I can set it up in my garage in the afternoon when my kid's sleeping or whatever else. So there's that. But for us, the way of doing work hasn't really changed because it was all mobile advocacy to begin with. So it's been all remote in the past. So we felt in some ways, a lot of our partner organizations have been, checking in and asking us how we've been doing this in the past, because now that's become everybody's reality where we aren't in one location. There is no office door to walk through and nobody can. But I do think our focus, driven by the community, driven by volunteers, has been on domestic violence has increased during this time because it's really obvious to anyone, just as Navneet began with, this is an epidemic. And the reason for those listening, when we say epidemic, right, the US stats have been consistent. 1 in 3 or 1 in 4 women are survivors, victims of domestic violence. Sikh Family Center did a needs assessment survey just with the Sikh community. And with those 1,000 surveys we got, 50%, almost 50%, is like 48.9 or something, percent of people had somebody close to them in their lives that they loved or cared about who was affected by domestic violence. And the flip side of that, I think, is important too, especially in the context today when a lot of people have questions about restorative justice and questions about how to change systems and all of that. If 50% of us know someone close to us who's a victim of violence, that also means it's very likely we are very close to and perhaps love and care for somebody who's also a perpetrator of domestic violence, an abusive person. And I think that realization, people don't often spell it out to us in those words, but it's very strong in the community right now. I don't think it's something that's invisible. It's something that's unaddressed. It's very visible, and people are very worried about folks close to them, either who are doing harm and might do more harm now when they're without jobs, when they're stressed out and have every possible excuse, which these are all obviously excuses for violence. And they're very worried about people they care about who are stuck in abusive situations. So we started doing short video series in Punjabi and in English, focusing on folks who are living with, and perhaps will even after COVID continue to live in abusive situations, but how to try to minimize the harm that's that they suffer or bring, or try to deal with, properly assess the damage or the danger that they're subjected to, and to make sure they're not one of those people who's so high danger, high lethality, that they're going to become another sad statistic in this country where, every day at least 3 women are killed in murder suicides, in domestic violence murder suicides. And we had just one in California in a Sikh, in a horrible case just a few weeks ago. And it happens all the time. So we want to make sure folks know this is so real and so lethal, and yet every case is not the same. So we provide case-by-case services. All of our organizations do, and folks listening should know that if you're hearing from us things that don't apply at all to anything that you're going through, that does not mean you're not a victim or survivor of domestic violence. It just means we only have a short amount of time right now, and we can't possibly go through the whole range of things that we see in our work.
Yeah.
One area that I just realized that one significant area, and I'm sure maybe Sakhi and other agencies might be seeing the same thing, where we are seeing an increase is the need for legal representation and legal assistance. And there is a huge gap and void in providing that service, specifically in our community. And when you add a language barrier to that, I think that really makes it so much more difficult for survivors in the South Asian community to reach out for help, to navigate the system, to navigate the legal system. So we have definitely, Manavi, seen an uptick in survivors who really desperately need legal representation, whether it's a TRO, like a temporary restraining order hearing, or a final restraining order hearing, or a criminal case. It could be immigration, family, criminal law, but there's a whole range of legal issues that we are seeing. And because of COVID, the courts were closed, but now we have started to see soft openings in court. And I think that's definitely been a huge challenge. And because of language barriers and making sure, I think one gap that we also see is ensuring that there are adequate court interpreters provided, whether remotely or in person, to ensure that our survivors, where there is a barrier in speaking English or having a language barrier, they are adequately represented legally. So legal representation has definitely been a challenge for us.
I can totally, understand all of that, especially the parts about interpretation being an issue, legal representation, and things of that nature. I can't believe we're already, about 35 minutes into this conversation, because I feel like we have a lot of questions still left unanswered. So I'll move away from the questions we had prepared, and I'll pose some of the questions that we're seeing in the Q&A chat. And for 2 of these questions, we have slightly touched on it. So this first one, earlier in the conversation, we're talking about abuse that is perpetrated by extended family. So this is a question for all the speakers. What are some tools that we can use to bring men and women elders in our home into the conversation? More time than not, this is usually where the behavior is learned.
So at Manavi, we recently, I think just a few months ago, applied for a grant and thankfully got it. And the grant is engaging men as allies for that precise reason that you're mentioning, because I think it's so important for men in our community to be engaged, to step up, to not only be part of the conversation, but quite frankly, I think we would want them to lead these conversations alongside women. So very often, so the way I look at gender-based violence is through the lens of human rights law. Just like Mallika, so in the past, I used to practice human rights law in the UK, so that's close to my heart. And I look at it, at the end of the day, a right to live a life free of violence is a human rights law. And all these international human rights law have this as a basic fundamental human right, whereas we see so many women and children and men who are impacted. So just to close the loop on this, I think it's very, very important. And some of the ways that we are addressing this is through this grant. We recently had a needs assessment that we're putting out. So any men who are listening and want to respond to that survey, please reach out to us. I think having more community outreach and education to South Asian men in the community, which is what our staff have been doing, so that they can be part of the conversation with peers, whether it's gurdwaras, whether it's schools, whether it's in the area of sports, but different arenas where men play an active role, whether it's public officials, and have them actually talk about this issue more publicly and how they want to be part of addressing gender-based violence in our community.
Thank you, Navneet. I think like Navneet touched on this, but this is not an individual issue, right? Or a family issue. It's a community issue, because there are survivors within the community, there are individuals who are perpetrating within the community, and there are individuals who are bystanders within the community, and that can be just as difficult. I think one of the ways in which to engage in conversation is through education, right? Parts of domestic violence are most of domestic violence is so normalized, right? Because there have been cycles and intergenerational cycles of violence and trauma that continue to exist within families and repeat within generations after generations after generations, right? One of the ways to put a break on that is just education, right? I would not say like engage in a conversation with everybody, because sometimes it can be difficult, it can be daunting, and it can be actually threatening to engage in conversations with everyone. But those that are willing to hear do have these conversations, right? Like, why is this happening? How is it that this continues to happen? Have people like those folks that are on the panel to facilitate discussions, right, within the community. And have community leaders and community stakeholders engage in conversations. One of the things that I always wanted to do within the community is to like host groups for women in like gurdwaras and other religious institutions, because that's where they all went, right? On a given day and during the week or during the weekend, right? Where they can have safe discussions. And if you feel comfortable, have these discussions with your peers in settings like, after school programs or when you're hanging out, right? Like, this is a community issue. Have discussions around education.
Yeah, I would add to those. So those are excellent suggestions, all of them. And I'll just add, I see a really useful way of talking to, I think the question's focusing on also how do you engage with seniors and adults, right? One of the things that hopefully works, that has worked for us in the past, is really talking about the impact of intimate partner violence, family violence on children. And any of you can, feel free to reach out to any of us, but there are articles and succinct articles, so you don't have to be a scientist to be able to make sense of them, of all the recent science we have about the effects of trauma on the neurobiology, the neurological development of children. Children are not just witnesses to domestic violence. Just by the fact that they can maybe hear something, they can hear muffled sounds somewhere in the house, they know that one person, or they can sense one person is scared of the other person, that makes a child as much a victim of domestic violence. It has a long-term effect on them. And it's not as simple as, oh, if this child sees violence, they're going to become an abuser. It's that does happen at higher rates for children exposed to violence, but there's a whole other range of things for their health and well-being that's affected. So I think, Vardiyan naal, dadiyan, naniyan naal ek gal can happen. You can enter this from the angle of the children, which I think is useful. And then the education, absolutely, in groups and in hosting discussions, but it also happens when things casually come up, right? When you're sitting at family gatherings or family Zoom rooms right now, right? Which is, somebody mentions case like, oh, de bare sunya, right? Like, what happened there? And some of us are just quiet, like, oh, what did you just say, right? It's not like, oh, that couple used to fight a lot. It actually makes a difference to say, no, actually fighting is very different, right? That whole Kali do hathan al wajdiya thing, we need to break that in cases where we know that one person is abusive and the other person has been trying to withstand that abuse in whatever way they have. So I think speaking up when our stomachs are turning when something's happening, instead of being silent, over time, that's what the culture shift work is about. Because again, that international or just the human rights law perspective, or think about it from the Gurbani perspective, right? Right? We teach our children, fear none, frighten none. This is not just about the bully who's going to pull your patka on the playground. This is about the bully who lives at home as well. And we really need to be, I think, need to take that stance when we are in relative safety. It's imperative we take that stance and say, no, sorry, you just use this language or some, she was so aggressive anyway, like this was going to happen. Oh, sadayam boldi si, right? It's like, she can speak in whatever way possible. It still doesn't make violence okay, right? Speaking up, I think, is really essential. And asking those questions of our leaders, as Pooja was mentioning, I mean, this is something that we can do in our Gurdwara. Instead of saying, oh, committees don't have anything about domestic violence, go ask them proactively with curiosity and some humility, because it takes a lot to run Gurdwaras and for as many critiques as we have. Go ask. And what we are really, why the Sikh family center is called the family centers, because of all the reasons mentioned prior, right? It's a family, the whole family, and you can think of it as large Sikh family or your individual families. But one thing that the Sikh family center we're constantly struck by, and this is what keeps us going, is you will find allies in the most unusual places. So don't look at a chitti dadi and say, oh, this guy's not going. I mean, this is an older uncle, right? That kind of ageism really cuts out of a lot of important allies from this discussion. So we have found people of all backgrounds and ages in our community to support survivors in the community. And I think that's important to keep in mind. So begin the conversation really with anyone, because you never know where you might either change some minds, or you might find someone who's like, yeah, I actually want to be part of, the work that you're doing or what you're talking about.
And thank you all for, sharing your thoughts on this. And I'm glad we brought Gurdwaras and our community spaces into this conversation. And about Gurdwaras, we've got at least 3 audience questions. And I know I already had one in mind. So we're all kind of in sync with this conversation. So the first question around Gurdwaras is, do you do any proactive outreach and education at Gurdwaras? Do you see a culture shift? The second can be, what are some steps that Gurdwaras can take to help end domestic violence? And the third piece of this Gurdwara portion of the discussion is directed towards Pooja. So someone said that, regarding your idea of having groups in Gurdwaras, many women would be afraid to go because I know that people try to look at what others would think of them. How do we make this shame go away? How do we make it so that survivors can get to these safe spaces, safe places safely? So, we've got a few different pointers that we can discuss around the Gurdwara discussion.
So go ahead, Pooja. Go ahead.
I can just start with a question that was addressed to me. It's definitely very difficult to hold spaces in gurdwaras, right? Like Sakhi has taken an approach in the past as well. We were specifically doing outreach in Richmond Hill, where there is a large Punjabi community, right? And it was very difficult. So we went on the path of economic equality, right? So supporting survivors either through ESL classes or through like citizenship classes or through job employment classes, right? Because again, that's a way to discuss like and address a barrier that they face. And like Mallika was saying, actually a lot of folks were very receptive to have us in the community to talk about certain issues. Yes, there were folks that were uncomfortable, and the discomfort comes from the fact that like a lot of folks don't talk about this, right? There has always been a silence around domestic violence. And when you start to lift silence off something by talking about it a little bit more, the shame starts to decrease from it. So yes, gurdwaras might not always be safe, but it's also about how you create a safe environment, right? So what is you as a service provider, in this case, me as a service provider, doing to create that safety? So some of the things that I've done in the past is to really like have safe discussions with committee members in the gurdwaras, right? Because often it's what they say that goes, and make them be allies, right? And to invite like survivors into that space to have like not necessarily discussions around mental health, but have discussions around like storytelling, right? Which is a great form of therapy that I utilize, right? Because talk therapy is not necessarily effective for a lot of survivors because it's very traditionally Western, right? Or art therapy, like creating something. And the creation was paintings, right? Or it was baskets, stuff that they like to do back home that reminded them of back home and created a safe space for them. So I would encourage taking like an activity-based approach first. And then when that trust has been gained, take it from there.
Thank you. Mallika and Navneet, your thoughts about how we can create these spaces at gurdwaras and if there has been some proactive outreach and discussions that are happening.
Yeah, I mean, organizations have been trying to do outreach at gurdwaras, whether that's tabling or all these different kinds of holding classes, making it more broad instead of like nobody's standing there with a banner saying, are you a victim? Please come in this door, right? That's not, I think no one's been doing it that way. But at the same time, what we saw with the Sikh Family Center so we took our surveys to the gurdwaras. And originally when we started handing out these surveys that had questions about child sexual abuse, they had questions about physical, intimate partner violence, they had questions about sexual violence. There were folks who were like, you're going to get yelled at, you're going to get turned away. And in all the time we've done those, I've been yelled at by 2 men, but that's it, out of the hundreds of people we talked to about it. So they're just going in and actually saying what we do, that we're talking about health holistically, and this includes questions about violence. I think that has a value as well as doing it in the more tangential ways of like, we're not, we're talking about health and wellness. And here we have this art therapy group, and some people might end up talking about intimate partner violence, but that's not a requirement. One of the things that we've put flyers up in gurdwara bathrooms, putting up our numbers and flyers. Oftentimes they get taken down, and then we have very committed volunteers who just go back up and put them again, right? We've had a survivor who fled from a state with a very small Sikh population with 2 tiny kids, with really no money in her pocket, and reached a gurdwara in Southern California and called us. And one of my questions, I was surprised this woman made it out alive given the range of violence she had suffered. And I just said, how did you know to call us? I mean, I know we've been doing outreach, but I know it's not that good. You come from a tiny community. And she said, well, 3 years ago, he brought me to Anand Garage in a gurdwara in Northern California, and I saw your flyer up there in the bathroom, and I hid the little tearaway slip in my shoe, and I've been keeping it for 2 years, that I will one day get to California to a larger Sikh Sangha, then reach out. And so gurdwaras really are, when we're saying that's where people go, they might go there once. Like she was hardly ever let out of the house because this man was absolutely controlling and abusive. But when she was looking for any signs of, are there people who can help me? And we're currently doing work with volunteers across the country. So anybody interested listening, please reach out to me, interviewing Granthis on and interviewing Gurdwara committees, just on their thoughts, right? It's not threatening, like not here's what you should do, rather, what do you do? And then it provokes the question of, you know, what should they be doing when it comes to cases that they receive?
Well, I am,
Sorry.
no, I was just going to say, I'm really glad you mentioned the point about even though we might feel like we sometimes hit brick walls with committee members, or you feel like our work that we do in Gurdwaras is ineffective. I am so glad you mentioned that piece that, you know, even just putting the thing with a little thumbtack on the bulletin board was life-saving. Sorry, Navneet Benji, to cut you off. Go ahead. Just wanted to say, you know, even though we feel like sometimes the small things we do are ineffective, we never know the impact that might have.
Absolutely. And I want to reiterate, I think sometimes as advocates and as agencies, we don't take the time to celebrate the small victories. So saving that one life and one survivor is something to be celebrated, and it's definitely a step forward. So at Manavi, we have definitely worked with different religious places of worship, so between gurdwaras, mosques, and temples, with varying degrees of success, to be quite candid. And I think it's really important to be strategic here. So it's important how you frame the conversation, how you enter that space, and knowing your audience. So one way that I actually recall this some time ago, where I had limited success or some success, was framing it under women's health. So we did a tabling event, and we had, I think we collaborated with a healthcare provider. So absolutely, I think the right way would not be for me to walk in and say, we're here to talk about domestic violence and sexual assault. That is not something where most gurdwaras or you know, places would embrace and say, come on in. So when I say being strategic, I think creating partnerships and collaborations where you walk into a space like that and say that we are here to talk about women's health. And of course, there are men who can be survivors. So talking about health. So I think one way we had success was having a tabling event, but even having a group. Now, essentially, it was a support group, but did we call it that? No, we called it's a workshop on health. Health could mean, you know, you do the screening, you have a healthcare provider with you who can talk about the different healthcare issues. It could be diabetes or other issues which impact the South Asian community, and you are there in that space together with them. And when you have a group and a confidential space or a room where you can have a group of women who may be interested, you gently open up the conversation and transition from we're here to talk about health and women's health. And by the way, mental health or physical health is also impacted by, and then talk about abuse. And I think using the right kind of language and building right partnerships, because at the end of the day, our goal as an agency is to have an in places of worship, in the gurdwaras, right? So I think being really strategic and ensuring that you build that trust and say that we are here, and also looking at it from a social justice lens, like I said before. So it could be that you're talking about social justice and human rights and women's health, and bringing it into the fold under that broader umbrella, and you know, going in. And we have had luck, and just like Mallika said, I personally remember working with a survivor who said she saw our flyer. This was in Jersey City, Gurdwara, a long time, years ago. It was a tabling event with a healthcare provider, and we were giving flyers about healthcare issues, but along with it, I had clipped the Manavi flyer, just attached to it in a folder. So it was just one of many other resources. She held on to it. Not only did she contact, but she actually got another friend later on who contacted us. So I think working in a partnership to, you know, so you are basically able to have an in.
Thank you. These are all really good points about how we can bring forth this conversation, even you know, and how we need to get a little creative sometimes in finding these allyships and partnerships within the community and also outside the community. We are at time, but I do have permission to go over by 10 minutes. It's not a lot of time, but I will pose the other audience questions we've got. I'll read all of them and hopefully we can answer as many as we can. I know that one is, two of them are heavier than others. So on the more of the easier question to answer, we've got, where can we find translated literature about how to help families navigate the divorce process, child custody, and how to have conversations with children? And also, this is one individual's comment. I can imagine that one barrier to people in our community accessing mental health and domestic violence services at gurdwaras, where they are available, might be a fear that conversations may not remain confidential. How could this be addressed? So this is the easier of our remaining audience questions. And then on the tougher side, we've got, do any of our community organizers have experiences dealing with domestic violence directed towards LGBTQIA folks in Sikh and or Punjabi families? And also, what are coping mechanisms and ways to survive when leaving the situation is not an option?
I can.
Go ahead.
We all just want to answer questions.
I know we all want, but go ahead.
I guess there's two questions that I want to touch on. I'll start with the mental health, right? Because that's my favorite topic to always talk about. So can you just, Aasees, repeat the question for me? Just because there were so many questions.
Yeah. So on the easier side was, where can we find the translated literature about how to navigate through divorce, custody issues, and how to talk with kids, and also how can we maintain confidentiality in spaces that we're holding at gurdwaras?
Yeah, you know, it's all about like the space you create, you as like the facilitator and you as like a community, right? So if a gurdwara is not necessarily a safe space for folks to have discussions around mental health, but let's say a community center is, maybe that's the space you want to have it, right? But in creating a safe space, you have to like come up with rules that everyone will follow and agree on. That's what I do when I create a group for the first time, right? First of all, I when creating a group for the first time, you know, when it's a group about mental health, it's not necessarily, folks are not necessarily responsive. So for example, like a really quick snippet, we had a group called the Mental Health Services Group, right, at Sakhi, and no one was attending the group. And we had no idea why, right? And as we were like, this was prior to my time there, but as we were thinking about it, it was because of the stigma that's associated with mental health, right? I'm not crazy, I don't need support, I'm okay, right? So we started calling the chai and chat group, right? And just because what do we love to do? Like we love to bond over a good cup of chai, right? Like a good cup of cha. So as soon as we shifted the name and like had food as a source, right? Everyone started to come in and to talk about issues that really impacted us, right? So first of all, I would say, think about the type of group you're trying to create. What are the ways in folks will feel safe within that group? And again, how can you actually create a physical space that will feel safe and welcoming? Because when you're doing trauma-informed work, it's also about creating a safe physical space. So if a gurdwara is not a physical safe space for some folks talking about these sensitive issues, maybe a community center is, or maybe the home of like a community leader is, or maybe like a home to someone who is really like the joy of a community. And that's what we once did. It was in a basement of a well-known woman within the community. And all the women went to go, you know, speak to her about recipes and all of that good stuff, right? And she started to talk about Sakhi. And then she had us come in and to then just talk to them and engage in a conversation about recipes. And from there, it just led to these enthralling, you know, conversations about mental health, right? So it's about like creating a safe space, It's about figuring out a space that will be safe, right? And making sure all the rules that are, put forward are followed by everyone. And the other question was about LGBTQI folks, right? So I have worked with, it's not necessarily just folks from the Punjabi and the Sikh community, but folks from the South Asian community who identified as individuals belonging to the LGBTQI community. And one of the ways in which I said it's helpful to cope while, leaving is not a choice, is to try to connect with other individuals who are support systems, right? So these are individuals who would, listen to you when you're having a tough time. Are also like other like service providers who can also equip you with like support while you're going through these things and residing at home, right? Because sometimes, like, it's just with a lot of other survivors, sometimes it's better the devil you know than the devil you don't, right? When they make that decision about leaving the home. So if you're speaking and having conversations with the skilled service providers, they might be able to equip you with a plan to leave if you do desire to leave, but to really like negate the situation by surrounding yourself with supports, and whether it's supports that like help you physically, and also supports that support you mentally.
So I wanted to thank the listener who specifically asked the question about the LGBTQI community, because that is such an important question and topic. And quite frankly, I think the Sikh Coalition and Manavi and Sakhi and all of us could do, and the Sikh Family Center, we could probably do a whole 2-hour conversation just on that. And I just want to point out another thing that very often, I've heard this from some community members or spaces where they're like, oh, that's not an issue in our community. Oh, that doesn't really, it's not something that we're concerned about or is a concern. Or, I think as agencies, I personally take responsibility, and I think we as agencies need to take responsibility that if we are not serving survivors from the LGBTQI community or not getting those calls, it's not because they're not out there, it's because we are not doing a good enough job to reach out to them. We are not doing a good enough job to do community outreach and education to build that trust within that community to say, we are here to support you, we are here to serve you equally. Just as any survivor from any other community. So I really want to take this opportunity to elevate this issue and this question that I think all of us need to make a stronger commitment and stronger efforts as agencies to do that community outreach. So at Manavi, we had done a youth summit last year, and we had a whole session devoted to talking about this, and we had panelists who shared their experiences openly and talked about what it was like to be from to basically be part of the LGBTQI community, and I think I want to mention the term intersectionality. So our survivors face they face discrimination and they face abuse based on their intersecting identities. And what are intersecting identities? It's based on their race, based on their gender, based on their sexual orientation, their disability, and the list goes on. So I think we as agencies really need to kind of take a much broader view and make stronger efforts to ensure we are serving all survivors and are aware of this intersectionality. Because, so going back to how we serve them, so we opened up this conversation, and at the Youth Summit, it really was so empowering, not only for members, from the youth who were part of the LGBTQI community, but also those listening to realize that we all need to be much more engaged. And I think the starting point is creating spaces to have these conversations more often and more openly and more publicly, to allow a platform where people can speak out, but then also talk about their barriers. And we as agencies need to step up and say, we are not doing enough. I know at Manavi, we should be doing much more. And, it's definitely on us. And we are absolutely here. Our mission to end gender-based violence and support survivors goes across all spectrums, and we are here to serve and support the LGBTQI community. And I think while I'm here, I'm going to make that commitment to continue to make a stronger effort to reach out. And anyone who's listening, who is interested in being part of that effort or working with Manavi, call us. Our number is 732-435-1414, or email us at manavi@manavi.org. I would be very interested and happy to collaborate and support that effort. And then the other two quick points, someone asked about translated documents. We at Manavi do have, our Manavi brochure is actually translated in various South Asian languages, including Punjabi, Hindi, Gujarati, Marathi, like various South Asian languages. So we have that we can distribute. We also have a booklet on navigating the legal advocacy. We have a legal advocacy program and do legal clinics. So anyone interested, we provide that. And so I can provide some translated documents if you reach out.
Yeah, and you know, from our end on the support side, we can definitely reach out to everybody that registered and share links for each organization, the volunteer forms, and some of these additional resources. And I know we do have to shut down in a few minutes here, but Mallika or anyone, would anyone like to speak a little bit about what are some of the coping mechanisms when leaving the situation isn't an option? I want to make sure that we give this question at least a couple minutes here before we have to end our discussion.
Yeah. So I think any domestic violence advocate that a person is able to reach out to, or sometimes if they're, especially during these times, living with an abusive partner, have a friend or a trusted person reach out to domestic violence agency. There, for us, a majority of cases are cases where people are in that in between of figuring out whether they're going to stay now till when their kids graduate or not. Like this is something we're very familiar with. It's something we create safety plans for, right? When things are escalated, move out of the kitchen, move out of the bathroom, move out of places where something might be weaponized and used against you. Today, in today's climate, tech safety, and in today's reality, tech safety is really important. And again, I'm not going to give specifics on here because, you know, the fact is we have people listening in who might use this against a victim as well. So I would really encourage you to think about any appliance in your house that could be used against you, to surveil you. Anything that's given to you by an abusive person that you're going to use to communicate is possibly going to be used to track you, right? So this doesn't mean that a person who's living within a home can't think of ways to create some sort of mental health reprieves and safety. They can, absolutely, but it is very, very case specific. There are folks who, while we're saying everybody's home, everyone's home, somebody might be married to a doctor and that doctor goes to work every day, right? So that might be the time they get their downtime and what to think about, who they should be reaching out to, how they might be able to access some services confidentially. I would say the therapy and that getting that help of somebody who's able to come up with a plan to just give you a mental break while you're living in a really tense situation is really important. Thinking about how to keep your kids safe is something we come across all the time. And people come up with very creative ways beyond turn on the TV and leave them in one room and dull the noise. People come up with other plans as well. And the resources in Punjabi or talking to somebody in Punjabi is one of the things we can do at the Sikh Family Center. 408-800 SEVA is our number. But I'm a big fan, and I just want to put this out there, even though you're hearing from organizations that are doing community specific work, right, where we are organized by our ethnic identity groups or faith groups, I'm a big fan of giving survivors options. And we often talk to, and this comes to the confidentiality question, this comes to the question about working with queer survivors, something we do as well. Sometimes people want to know, what are other agencies out there that actually, and this might be counterintuitive to folks, as much as cultural humility and competency is important, we do have folks who are like, I want to go somewhere where I'm sure nobody will ever remember my name. So some survivors find comfort in, oh good, like I'm just talking to somebody who, thinks I have a name hard to even say. And I'm okay with that. That's their choice, right? It's not our thing to enforce. Well, you must talk to somebody from your own community. So sometimes that, if that's where they are at, if confidentiality is such a huge worry, and if we aren't able to create that safe space that Pooja was talking about, then it's okay to give them a list of options. Actually, it's not just okay. I think it's advisable to give them a list of options, because the important thing is for them to get services. It's not for them to get the services the way we think or anyone else thinks they should be getting them.
It's a really good point, and that, actually, it's a really good point to even end this discussion on. We have ran over time, but I think it's because, we had such great and engaged listeners and audience with us today that, we couldn't have helped but go a little over time. That just goes to show us that our community is ready to invest, is ready to start talking about these issues, and is ready to, do the little or as much as they can to bring forth this conversation. So, I especially want to thank everybody that has tuned in. This was not a fun conversation to have, but it's certainly critical, and it was one that was very enriching. So thank you everyone that has joined us tonight, and a huge thanks to Pooja, Mallika, and Navneet. I am continuously blown away and impressed by all of the amazing work that, your organizations are doing and continue to do. I know, personally speaking, from the legal team, I've reached out to each of these organizations that are on the call with us, so I can say that, they're always accessible, they are reliable, and, if anyone needs any services, please do turn to them. With that, thank you so much for joining us today, and we will see y'all tomorrow with day 4 of Sikh Coalition's Summer Series program. Thank you and have a good night. Bye-bye.
Thank you.
Peace.
Thanks. Good night.
Thank you.